So welcome to Frontier Nursing University. If this decides to cooperate today. My name is Dr. Kara Jefferson, and I am Program Director for the Doctor of Nursing Practice program, the DNP here at Frontier. You guys just met. If Dr. Gianellis would like to come off and just say hi for a second. Dr. Gianellis is one of our DNP project faculty, as well as course coordinator for PC 743, which is our implementation course.
Hello, everyone. Hi, welcome. We're glad that you're here. And I'll keep an eye on the chat for you.
Okay, perfect. So here at Frontier, our mission is to provide accessible nurse midwifery and nurse practitioner education that integrates diversity, equity, and inclusion into all the things that we do, because we find that it's really important, especially considering where Frontier has been and where we're going in the future. But the big part about this, our mission statement that I want you to be aware of, is that it says we transform healthcare by preparing ethical, compassionate, innovative, and entrepreneurial leaders. All of those words are very important because at our very core, what we do in the DNP is we help you get there, right? We don't give you the ethical portion. You've already had that. You've become an APRN. We just take it to another level. Same with compassion. We know you're already compassionate. You came into this profession because you wanted to help people. We're just bringing it up another level and helping you to view things a little bit differently with our DNP. And of course, we emphasize rural and underserved communities. This is actually the old mission statement, but the new mission statement encapsulates all of these things. So in this informational session today, we're going to go over all of these things. So why would you even want to get a DNP? And then why would you even want to get a DNP at Frontier Nursing University? And I'll tell you why. We're also going to discuss our programs of study for our DNP, the admissions criteria, the DNP project, which seems to be everybody's favorite topic, the thing that everybody asks the most questions about, how you actually get started, and what we do in our advising sessions for the DNP. So for those of you who don't know, because we have a mix of likely companion students, which are our students who are currently getting either a postgraduate certificate or an MSN, but meaning that they are attending Frontier right now, or a postmaster student, meaning you've been out of Frontier for at least 2 years, or you're coming in brand new, and we'd like to say welcome to our community. But one of the things that we do really well here is what we call the culture of caring, and it encompasses us all. What I found in the past is that when we go to other schools, sometimes we're not treated as a professional. We're not respected as a student. Here, yes, you have this hierarchical system where you have an instructor and that instructor is giving you a grade. But at the end of the day, we respect that you have a background. You're already a professional. And so we expect mutual respect between the two. You respect us, we respect you, and we always want to treat one another with civility. The great thing about us is we are a distance education program, and we do distance education very well. So wherever you are in this world, your home becomes your classroom. We're not asking you to commute to campus or any of those things. Yes, you may have to attend certain live sessions at a certain time, like some things are synchronous rather than asynchronous, but you get to study from the comfort of your own home and in your own time. So there's not me or anybody else over your shoulder saying, hey, you have to do this at this time. You're an adult learner, so the expectation is that you will make time on your schedule for your studies and to get your assignments completed. And one of the best parts is that we have you travel to our beautiful new campus in Versailles, Kentucky, for what we call DNP bound or DNP Frontier bound. And that is a 2.5-day immersive experience If you're a companion student, you don't do that 2.5 day. If you've been at Frontier within the last 2 years, you can actually qualify for the 1-day virtual bound session, which some people opt to do, but it's a great chance to get to know me, get to know the DNP faculty, but learn a little bit more about what our program is all about. And I can't stress enough how many students who've come through this in the past have come back and told us, oh my gosh, I really did not want to come here, but it was truly the best thing that I've done because I got to know my other classmates who were feeling some of the same trepidation that I was feeling. So if you have not been or don't know anything about our campus, this is what it looks like. We have actually only been having students on campus for, it's actually coming up or making a year right now. This first picture is an example of what the student lodges look like. So where you would stay if you were to come on campus. This next picture right here is a picture of the president's house, and we do have a reception where the admins on campus and all of us, we just kind of hang out that night at you get to tour the house, that kind of thing. This third picture right here is the welcome center. So it's where every single student who shows up for our on-campus bound goes to be welcomed and given instructions on what the weekend looks like. This is just a broader view of our whole campus. And then this picture in the middle is our dining hall, which has delicious foods. And this is the actual first sign that you see when you're driving up on campus. So we are very happy to have that campus. Some of our achievements is that Frontier has over 80 years of experience in graduate nursing and midwifery education. So we kind of know what we're doing, especially from the distance perspective, because it's the way that we've always done it. And we have students and alumni that come from every single state. The other great thing about our DNP program is some of our DNP students actually do not live in the United States. They're licensed in the United States, but they're doing their projects in like South America or a part of Africa, or I even have somebody right now who's in Germany. We've had over 8,000 graduates from our program. And like I said, we know online education. A few of the other achievements that Frontier is proud of is it was recognized in 2022 as a great college to work for. It has also been a top college for diversity, and we received the International Distance Learning Award presented by the U.S. Distance Learning Education in November of 2021. So these are just a few of the things that we're proud of. The other thing that I am really, really happy with that we tend to do very well is the amount of student support that we give you. And when I say student support, I don't necessarily always mean what you're getting from faculty, although faculty provide great support. I'm talking about all of the other support, because in your classes, you'll find that you have online student groups. So within those student groups, you may connect very well with one person or another person. And so those people can become your resources. You also have the faculty mentors, especially when you get to your DNP project. Your DNP assigned faculty will get to know you and potentially your family very, very well. As we know, we have great financial aid advisors. Our librarians are the absolute best. Carla, Zach, and Billy Ann are there to help you with every need. We also have a diversity impact program, which is a nice weekend that we now offer virtually to everyone. But what's not on this list is that you also have academic advisors. So if there's anything that comes up in your life where you just need somebody to talk to, your academic advisor is the first place that we recommend that you look, because they keep an eye on you throughout your whole program. So, oh, there it is, academic advisors. So again, I'm Dr. Kara Jefferson, director of the DNP program. We met Dr. Gianellis, who is both a course coordinator and a course faculty in the DNP program. I just spoke to you about our academic and financial aid advisors. And then we also have a credentialing coordinator specific for the DNP, and that person is currently Megan Cadwell, and she helps to ensure that whatever site you will be using for your DNP project is appropriately credentialed so that they have everything that they need and we have everything that we need. So we really don't work in a silo. The pictures down here, of course, Dr. Gianellis, and then you have a few of the advisors, and then a picture of Zach, who is one of the librarians. So here is the $100,000 question, right? Why in the world should you get your DNP? Well, that's a great question. We know that it takes an average of 17 years to implement whatever we perceive or whatever we know to be best practices into our actual clinical practice. We also know that when we assign you textbooks, that the information in the textbooks is it's already outdated. By the time a textbook is published, it is already outdated. But what we know, that we truly do know, and we have an experienced faculty to prove this, is quality improvement happens all the time. It happens everywhere, no matter what setting you're in. So when you get a DNP, you learn crucial quality improvement skills that not only pertain to what it is that you're doing right now, real life in practice, but you can apply these same concepts to anything that you do. So it's also a terminal degree. So for those people I've met quite a few people in the past who are like, my dream, or no one in my family has ever had the opportunity to get a terminal degree. And so this DNP gives you that opportunity. I like to distinguish the difference here between a DNP, why should you get a DNP, versus why should you get a PhD or perhaps an educational doctorate. The DNP is a clinical focused degree. So that means likely most of you are either brand new to practice or you've been practicing for a really long time and you're already kind of an expert in that area. We take that so that everything that we do is geared toward your patient, towards patient care, improving patient outcomes. Whereas if you were to go and get a PhD is heavily research focused. So a PhD project would look like, I need a control group and an experimental group, and I'm going to give one person something and maybe not the other group. Whereas when we're doing quality improvement, everybody gets the same thing. The same interventions, we're doing them with everybody. If you were to get an educational doctorate, that means that your focus would only be on education. There's also a doctorate in midwifery. I've had people ask me, well, I'm a midwife. Why shouldn't I just go get a doctorate in midwifery? Well, you could, but you'd be really limiting your scope of practice, right? When you get a DNP, you can do all of those things. You can still teach with your DNP degree. So that takes care of the educational doctorate and a little bit of what you would get in a PhD program. A PhD dives really deep into the literature. We dive deep into the literature, but the literature that we're diving in is truly that evidence-based practice literature. So those are things to consider. Your DNP is applicable right now to what you're doing, rather than something in the future that you may or may not be doing. And if you want to teach, most programs require now that you have your doctorate degree. So you might as well get your doctorate where you learn more, fine hone your educational skills, but also your clinical skills and your clinical expertise. Oh, did I go backwards? Let's see. Well, my computer's going crazy now. There, sorry. So here are your admissions requirements for a postmaster's DNP. So again, you're considered a postmaster's student if you have been out of Frontier for at least 2 years or are coming to Frontier as a DNP student after you've gotten your MSN from another institution. You must have a current active registered nursing license in the United States with no encumbrances, and you have to have national certification as either a certified nurse midwife or a nurse practitioner, whether it's a family nurse practitioner, psychiatric nurse practitioner, women's health nurse practitioner, doesn't matter. You must have a 3.0 GPA. You will submit 2 essays and a transcript if you're a postmaster student, and currently 3 health professional references. Oh, here my computer goes again. Sorry. If you are a current student your process is a little bit simplified, right? But you still have to have that master's degree, the current active registered nursing license, no encumbrances, because we do go back and check. You write a narrative statement and you have one professional reference. And then we have our programs of study. And don't worry, I will give you guys a chance to unmute and ask questions after we go through the next slide or two. So our postmaster's DNP has one program of study. Our program is 30 credits. It can be a little bit more depending upon, sometimes some people have to retake PC 739, which I'll go into a little bit later. But the core program is 30 credit hours. It can be done in 18 months, which is a year and a half. We have the term system. And so each of our terms is 11 weeks where you are actively engaged in your coursework. And then there are 2 weeks where we tell you take a vacation, actually get reacquainted with your family and your friends so that they don't forget that you really exist, maybe your children, but you really, really go back to establishing those things that are really important to you. The DNP project actually begins in term 3 with our first pre-prep course, which is DNP clinical prep, and we'll get into that a little bit later. Our DNP has several didactic courses. There are 6 of them to be exact. Some of you, especially if you are a companion student, you may or may not have taken PC 702, PC 713, and PC 718, which is Epi and Biostats, Principles of Independent Practice, which actually has a name change coming up if it has not already happened, and Evidence-Based Practice. And then the first course that all DNP students take is Nurses Educator. So that is the first course that will be in everybody's plan of study. And then you take, it's actually Ethics and Health Policy. We changed the name of that course. Instead of Health Policy and Advocacy is Ethics and Health Policy. And then Leadership and Organizational Dynamics. So every single course is not something that we teach in a silo. Every time you take a course, that knowledge from that course will keep building as you go through the program. So don't think that what you learn in Nurses Educator is not applicable to what you're going to be doing in your last term in the DNP, because it's all applicable. But it's also applicable not just to school, but to your real world setting. And then we have our clinical courses, and we call it clinical courses. For most people, the word clinical throws them off. So I also sometimes call these our DNP project courses. And the first course is DNP clinical preparation. This is where we get your site credentialed. We start talking to your site. Actually, we start talking to your site right after you come back from DNP bound, so that you have all of the necessary tools to be successful once you get into PC 739. We have PC 740, which is our project planning course. PC 743, which is our implementation course, and PC 744, our dissemination course. When I've done these Q&A sessions in the past, students are always like, oh my gosh, are you serious about these numbers that are on the screen and how much time this is actually going to take? And my answer is absolutely yes, because you become a project manager. And for many of you, that is an entirely new role. And in order to embrace that role and fully understand what it means to be a project manager, but also perform the quality improvement and quality assurance that goes along with that, you have to dedicate time within the site. So if you're already working in the site, your work days do count as long as you're incorporating aspects of your project in there. There also may be times that you have to go into the site, potentially if you have to access charts, that kind of thing, or maybe have a meeting on a day that you're off in order to get your assignments done. That's just the expectation of the program. So for both planning and implementation, we expect you to be on site a minimum of 3 days per week. It could be 4, it could be 5, it could be 6, it could be anything above that 3, but it has to be at least 3. And that is one of the things that's absolutely non-negotiable. And then for PC 744, the only on-site requirement is that you must present to your stakeholders your final DNP presentation, because at the end of the day, You didn't do that presentation for me. You didn't do that presentation for Dr. Gianellis. You did that presentation for your patients, your site, to impact care within your community. So here are our upcoming application deadlines. And I know you still have questions about all these other things, and I promise we'll get to that. But our next application deadline is June 28th, and you would begin coursework on October 9th. So October 9th is considered our fall 2023 term. And then the deadline after that is September 27th to begin coursework in January. Probably not January 1st, since that is New Year's Day. We're typically closed, but it'll be one of the first few days in January. Our application is really simple. It is online. You submit an essay. So let's talk about the essays and the application for just a minute, because as someone who has to review some of these applications, we always want to make sure that you put your best foot forward. Like, we want to see the best version of you. And so that doesn't mean writing your essay at the last minute, because when we're looking at those essays, we are looking for clarity of thought. We are looking at your grammar and your spelling. So please, please, please use spell check on whatever you have on your computer to be able to check those things. My best advice too is to actually read your essay aloud after you think that you have it done, because chances are that's when you'll be able to correct some of those errors. For your resume or your CV, you want to be able to put down all the things that you've done. A lot of times we discount some of the things that we have done and we think that they're unimportant. But if you've ever spoken or done a podium presentation in your career, put that on your resume. If you've ever precepted a student, put that on your resume. If you're heavily involved in a community organization, add that. We want to see the best version of you. And then we also ask for a health professional reference. Guys, I know that when we are looking at references, we always want to pick the person who loves us the most. Of course, who doesn't want that, right? You want that person to say the most glowing things about you. But honestly, from our perspective, the actual best references are your immediate supervisor, because they know you better than anybody else. They typically know the quality of your work. They know what you're capable of. So those are the most meaningful. And then, of course, your transcripts. Our tuition right now, up until we start summer term, so students enrolled right now, paid $646 per credit hour. Starting in summer 2023, we had a 3% increase in tuition, and your tuition for these upcoming application deadlines will be $665 per credit hour, which is still one of the least expensive DNP programs in the entire country. So just to recap, what do we offer you? Well, you get the DNP bound experience, you get 6 didactic oriented courses, and your DNP project courses that are applicable to your setting in real life, that you can apply at the time that you are actually doing the project. There are currently 2 methods that you can enter the DNP. There is the direct admission process. You can only use the direct admission process if you are currently enrolled in Frontier's one of their Master of Science Nursing or a postgraduate certificate student, or you would do the standard admissions process if you are a graduate from Frontier over 2 years. Well, not for the application process, sorry. You would do the standard admission process if you've been out. So let's say you were a student and you took this term off, you would actually have to go through the standard admissions process to come back into the DNP if you decided that you needed a break between. And then if you're applying because you got your MSN or postgraduate certificate at another institution. So the path that you take is dependent on whether or not you're a student now or you're coming back from the outside or coming to us for the first time. So let's take a break. I will stop screen sharing so that we can answer any questions that you may have. Are there any questions, Dr. Gianellis?
Yes, so I was just starting to, I'm going to let you speak to this. So there was questions about 713. And I had started to say that 713 is one of the courses that is in the revision process. Someone was asking about, should I take it if I'm not sure? And then someone else said, well, I've already taken it. Does that mean I'm going to have to retake it? And so, yeah, that I said I'd let you address that. I had sort of alluded to, you know, it really depends on your timeline and how long before you thinking of coming back.
So if you are currently enrolled in the FNP or psych or any of our MSN programs at Frontier, my best advice is for you to opt in and take those courses right now. Because if you take them now, I don't know if you guys all know, but our companion DNP program as we know it, it is going away. It is going away. It's only got a finite number of terms left. So as we start phasing that out, which won't occur until sometime next year, the latter part of next year, you want to take those courses now. If you take those courses now, the trifecta, right? So you can't say, I'm taking just evidence-based practice and I'm not going to take the other ones. If you do the trifecta now, if you come back before 2025, I apply that course credit to your transcript. If you decide that you do not want to do your DNP until after that deadline has passed, if we have any major course revisions, which we currently have, PC 702 is currently undergoing a major revision. All of them actually, 702, 718, and 713 are all undergoing major revisions. So if you don't take them now, then yes, you will have to take them then. So I say you have the option to come back having 21 credits, which already decreases your load. That potentially takes away one term, possibly two for you. So I would encourage you, if you're a current student, to go ahead and opt in and take those courses now.
If someone has already taken those 3 courses, they're finishing their DNP, so they're a companion student, how long does the DNP program take?
So the DNP program will take either 12 months or 15 months, just kind of depending upon how we schedule that. And I see Jennifer has a question. Please feel free to unmute. I don't like to be the only person unmuted in these calls.
Hello, can you guys hear me?
Yes.
Yes, hi, thank you. I'm Jennifer Skinner. So I see that the options for the DMP, you have quality improvement, you have, I think it's education or something like that, and 2 other things. When you are applying for the DMP, do we have to select which kind of focus we want to do, or this is just embedded into the DMP in general?
Yes, that's a great question. So all of the courses that I mentioned, and even when I talked about the differences between the DNP, PhD, educational doctorate, doctorate of midwifery, our DNP program encompasses nurses educator. It has ethics and health policy. It has leadership. So when you do our DNP program, you're not opting into a certain specialty at this time. You are simply getting your DNP and it's applicable across any setting. So you're not having to, when you do the application, there is no option to say, I would like to do a DNP with an educational focus. We don't have that. Every student just does our DNP, and it includes all of those items.
Okay, I see. Thank you very much for clarifying that. Now, I did an application online and I signed the document for, I guess, you guys to complete the request of transcripts. from my previous university. Now I have an MSN, and then I also have a postmaster's in FMP. Now you guys need the transfer from both, from each one of those programs, correct?
Yes. Yes.
Okay. And so would you guys reach out to me once you get that, or do I have to go back to the website and or email someone? I don't know exactly what the next step will be from after that.
That is a great question, and I am going to defer to Richard. He may know a little bit more about that.
Yes, hello everybody. Richard on behalf of the admissions team. And yes, Jennifer, I'll follow up with you, but at this point, once those transcripts are requested, if Frontier is able to order them on your behalf, we'll just attach them, get the file, move forward. At times, if a third-party institution doesn't release the transcripts, then at some point, students do have to order those transcripts. But I will follow up with you. I had emailed you, and I'll email you back. And hopefully we can converse today if that's best for you, or for anybody here in this meeting. I'll post information for admissions so that if you have further questions or just assistance, the admissions team would be more than happy to reach out.
Nice. Thank you very much. So should I send you my email address in the chat?
I actually have it. I could email you after this, and we could correspond if you're available. If that.
Okay. Thank you. Thank you very much.
You're welcome.
Hi, this is Tana Romeo. Can I ask a question?
Absolutely.
Okay, can you guys hear me okay?
Yes, we can.
Okay. So I'm currently enrolled in the CNET program at Frontier. I have taken all 3 courses that, you know, at the time I've been on the slow track, so I was in the program when they were all required. I am currently in my clinical rotation, and I'm starting my 2nd clinical course. The bottom line is I am set to finish clinicals and my comps course probably sometime in August or September. Is it possible for me to still start in October, or will I have to wait till January?
So you will not have to, as long as your MSN is conferred and it is expected that you will pass. My understanding based on that is that you would be able to go straight through. So your graduation, you said, would be when? September?
I will be finishing up. So during the summer term, I will take 7, 14, 15, 16, and the comps class, because you know, clinicals just run one into each other, and I'm anticipating that I will be done with all my clinical skills and hours by the middle to end of August, middle of September at the absolute latest.
Yes. So here's the other thing. So if you are a companion student, I don't know if you guys realize, but if you go to your degree audit, and I know that all of you who are currently enrolled in Frontier will be meeting with your academic advisors. But if you go to your degree audit with your academic advisor, there is a link at the bottom of everybody's that says transitioning into the DNP, and it outlines, like, if you graduate in this term, then your deadline to apply is here. So technically, in this particular scenario that was just presented, you could finish up your MSN in September, apply right now before June 28th to start in our fall 2023 term. And as long as you know, your degree is actually conferred, yes, you would be able to start the DNP that very next term.
And it looks like Natalie and Bria. Oh, I'm so sorry. Anna. Go ahead.
So for some reason I didn't pass and had to repeat a course, like let's say it was the comps course. Could I delay until January, or would I have to reapply?
No, so you would, that's a very good question, and that I honestly don't know the answer to. I would suspect that, let's say you didn't pass one of those courses and you had to retake it. If you had to retake a course, that would make you a MSN student for that next term, which would be fall. So they would likely, don't quote me on this, they would likely defer you to the next application course. But we're not even going to think that way, right? We just know
Correct.
that you're going to pass all of these classes so that we don't have to worry about it.
Okay, and then my last question is, what is the application fee for a companion DNP?
Currently, I think the Richard, do you know that? Because I might be speaking on what we just did instead of what is currently occurring.
Yes, hello again. So currently for the fall term, it had been a $50 application fee, but that's been waived for the DNP program at this time. And there was an update too, just a little added information in regard to criteria. There had been an update. It was 3 health professional references. It is now 2. So I'll post that link as well. That was just a recent update.
Perfect.
I had a question, if I could.
Yes, absolutely.
This is Beth. And I think Kristen just replied to Gloria, kind of answered the same question. Full-time employed APRN. So we can typically use our work site as our DNP so that we're going to be able to kind of combine things. And
yes, and
okay.
that is one of the strengths of our DNP program. A lot of the other DNP programs out there treat you as though you are like an MSN student, where you actually have to get a DNP preceptor, and we're going to go into that into the next couple of slides. But
Okay.
our DNP program allows you to use your current place of employment, as long as you have buy-in and permission,
Okay.
as your DNP site, because at the end of the day, we want this to be for your patients in your community. And if you're with a preceptor, those aren't your patients. That's not your community necessarily. That's their patients and their community. And so we try to make this as easy as possible, especially for postmaster students, because we know you are generally working 4 to 5 days a week, and it's not feasible for you to find somebody to go and precept with 3 days per week.
Okay, thank you very much.
Just as a follow-up to the prior question about going as a companion student, going straight through to application, there was 2 questions in the comments about companion students, how much time they can wait in between. You know, certainly understanding that you may need to rest for a little bit before you take on another program.
Okay. So right now, for a companion student, and I'm reading this straight from the slide because I want to make sure that I don't want to get this wrong, but direct admissions for currently enrolled MSN and PGC students. If you are in your last term of your MSN or PGC and you want to start the DNP immediately with a short break, we currently have a non-competitive review process, meaning if you're one of our students, we're saying, hey, you actually are not competing with all of the postmaster students. You do the application with no application fee, and we will get you in. If you decide that you want a longer break, meaning more than 6 months, so more than like 1 term or 2 terms, you will come back and you will complete the standard admissions process. Does that help?
Can I actually ask a question? And I'm sorry, I probably missed
ask away.
The last couple minutes of what you said before what you just said. But so I'm a current student. Next term is my last term. I would like to start maybe fall or January, but no matter which academic advisor I talk to, I can't seem to find where on the website I put this application in for the direct admission. So I'm kind of at a loss as to where do I go? What do I do? What do I submit?
Okay, so if you would not, I have not found that the website, the easiest way to do this is to go get out of the portal page, get completely out of the portal page and just go to portal.frontier.edu. Richard, if you don't mind dropping the link, because there is a page on Frontier's website where it shows the applications, and they have them all listed. And one says a direct admit application, one says for a postmaster's, because I just actually sent this to someone a couple of days ago. But if they drop that in the chat, you'll be able to see exactly where it says direct admissions, and that would be the application that you would use.
Thank you.
And I'll post that right now for everybody.
Yes. And Dr. Gianellis answered the question to you, Amanda, about New York. So yes, if you come to us and you live in New York as an MSN student, we just wouldn't take you because we don't have the capacity for clinicals. It's different for DNP students because DNP students are typically already working in an environment or already have a job. So it would just be up to you to coordinate that with your employer. But the New York's main problem is that they didn't want us competing for clinical sites with the schools in New York that actually needed those sites. So our last admission into the companion program, the last time you can be admitted and still have your companion status is going to be October 2024.
I have a question about going in directly to the DNP. If I continue to work as a staff nurse in my current role and wait, is there an option? Like, do I have to work as an APRN
This is a lovely
in the
question.
DNP program? And can I do my project on my current unit where I'm working, and then after my DNP go into my nurse practitioner role?
Yes, absolutely. So I'm so glad that you brought this up. I was actually going to talk about this in the next section, but this is actually the perfect time. So for those students who are current MSN students who, in particular, it's sometimes very difficult for you to transition to a new role, get fully onboarded to that role and know all of the nuances. So it's like you're doing multiple things at a time, right? You're so excited, you've just graduated, you have this piece of paper, you've gotten this new job, but you also want to do your DNP. I don't know how that sounds to you, but to me, it sounds a little bit like I'd be swimming in a pool and like there's no life vest, because really there isn't. It is recommended that if you are going to go straight through, that you clearly know what your boundaries are, where you will do your project. So if you're an RN, you can stay in that RN role as long as you know that you will be there for at least the 9 months of the actual DNP project courses, and can be there 3 days a week in case you get a job. But what has been happening is sometimes students go and they decide, I'm going to go straight through to the DNP. And because they've already taken some of the DNP courses, then they end up being like, oh my gosh, you guys set me up for failure, when we honestly didn't set you up for failure. You could have done the project at your current site as an RN, or you could volunteer as one of your in one of the sites that you just completed your MSN clinicals. But if you decide that I'm going to start my DNP project as an RN, and I got this amazing job offer that I'm not going to turn down, and I'm going to take that job, your DNP project is not going to work. You cannot, in the middle of your project, say, I'm just going to do the exact same thing I was doing over here in this new site. That requires you to go back and re-credential a site. So you would essentially be going back to PC 739 and retaking that course too. So I think it's very, when you're planning this, you want to know and have an idea of what it might look like. What's the timeline for you to get a job? So maybe it is that you take the 1 to 2 term stop out, because our goal here is to see you successful and not frustrated. We want you to be successful, and we know that if you have no clear plan going in about your job situation, it muddies up the water a whole bunch. Does that help?
Yes, thank you. That's extremely helpful because I work on an inpatient psych unit as an RN, and then I'm going to work in my hospital for my clinicals with the consult liaison team. So I kind of have a couple options, it sounds like, from the setting if I continue to work in my RN role
Yes.
for my DNP project.
Yes. It works.
Okay, great.
Yeah, it works.
Okay.
It's just you've got to commit to it and know that, you know, if you decided to eventually take an APRN, it would be great if you took an APRN job with that same site. But if you decided to move to a new site, the best time to move would be in the last term, where you would be taking PC 744, which is our dissemination course, since the only on-site requirement is you actually have to go back to that site to do your final DNP presentation.
Got it. That's great. Thank you so much.
You're welcome. So I will start screen sharing again, and there will be another opportunity to ask questions. So all right, can you guys see my screen? Yes, perfect. So now we're going to go into a little bit more about the DNP program and the specific items pertaining to that. So here is the thing that gets everybody like, oh my gosh, I don't even have a project topic. What am I going to do? And the good news is today, you don't have to have one. We're not requiring that of you right now. We actually don't even require you to have one when you come to campus or attend the one-day virtual DNP bound session. But for those people who are like me and are like, I want to know because I'm a planner, this is the information for you. All of our projects are based on evidence. So we have you looking at guidelines. We have you looking at best practices for a whole bunch of things. They all must be site driven, meaning they must all also be clinical projects. We cannot do our DNP project since the DNP is a clinical practice doctorate. We cannot do our DNP project in a nursing administration. Like I could not say I'm going to do my project with Frontier Nursing University faculty. That doesn't qualify as a DNP project. But if Frontier had a health center, I could do my DNP project at their health center because it would be an academic health center that actually sees patients. So we focus on patient outcomes and populations. So we do have volume requirements that you'll learn more about during our DNP bound session. We try not to go into the weeds about those specific things in this session. It's just a general overview. But all of our projects are driven by the needs of your site, meaning we don't want you in a silo to say, oh, I'm really passionate about XYZ topic, so I'm going to do my project on that. No, we actually want you to meet with your quality improvement department or committee, your unit manager, your collaborative practice physician, if you have one in one of those states, to really talk through the process to figure out what is the best thing for your actual setting. We also focus on the Institute of Medicine domains of quality care, and those are listed right here: safe, effective, patient-centered, efficient, timely, and equitable care. A lot of times our DNP projects end up being combinations of several of these, but know that whatever project you pick has to have at least one of these as the main themes. We also have you focus on team engagement because we know that you are not doing this project on your own. it takes a team of people to make anything work. And so that's why you get those necessary skills in all of our didactic courses to help you when you get to those clinical courses, as well as patient engagement. Because a lot of times what we've done as healthcare providers is tell patients exactly what we want them to do. And all the literature shows that the reason that we have non-compliance, which is a bad word, or even non-adherence, is because we keep telling them what to do instead of asking them, what is it exactly that you want to do? So we build that into our DNP projects. And our projects are something that are solving a daily problem, meaning you're not going to select a project topic where you only see that once every 3 weeks. No, you want to select the project topic on something that you notice is a daily problem. So maybe the daily problem has to do with clinical flow. That's a good project. Maybe the project is surrounding a more general topic like obesity care and what you're not doing to meet the guidelines around that. That's a good topic. But choosing to do a project and knowing that you'll be implementing the project in the summer and you want to do a project on flu vaccines, it's not a good project idea, right? So we want to be really careful about also looking at the calendar and the timing of things as we are selecting these things and talking about them with your site. The good news is by the time, hopefully, most of you come to Bound, and I can't promise if you're coming to this upcoming Bound, but if you come to the Bound session that we have in the summer term, by then I will have had time to, marketing will have had time to brand my deliverable document, which completely outlines our DNP project to your site and your site leadership, so you'll know exactly what to do. So a lot of questions that we get is, what do we do in pre-planning or PC 739? And in PC 739, it is a 1 credit hour course where we talk about the project a little bit more, expectations, but it's really getting the preparation out of the way so that you can be fully successful in your project. We have you complete the Institute of Healthcare Improvement modules. I assign you to an individual faculty member to have an advising session where you can talk about, what does work, life, and school look like for you? Do you have a balance? Do we need to change your program of study? Is your project topic idea a good one? Is it realistic? Do we have the volume? Will you potentially need to undergo IRB? Or is there a possibility that we may have problems with credentialing your site? We do that in the first 2 to 5 weeks of PC 739 so that you are successful. We also have you start looking at the literature so that you can get started, so that on day 1, when you enter PC 740, which is our project course, you know exactly what to do and you know exactly where the literature is on your project so that you're highly successful.
Question?
Yes.
What's IRB?
IRB, thank you, because I'm so used to saying all this. I think that everybody knows all of this terminology. IRB is Institutional Review Board. So if you work at a larger hospital system, or the VA, for example, Veterans Administration, sometimes sites like that make you go through a process to determine whether your project is indeed human subjects research or it's quality improvement. And they will tell you. So when you come to DNP Bound, we go into a discussion about how it is that you should actually be talking to your site, who you should be talking to at your site, so that you know the exact verbiage to use. Now, despite that, some sites that are larger systems, they still may require that you undergo their process. And the thing about the process is it can take as little as a week if they put you through the expedited process, or as much as I've seen as 1 year. And so these are things that we need to know ahead of time, because of course it affects your plan of study at Frontier. And whenever you start your degree, we actually have a degree completion timeline that you must be finished with. So for example, if you're coming straight from our companion program, your entire DNP program must be completed in 2 years. If you're coming through the postmaster's route, your entire DNP program must be completed in 2.5 years. So you have a little bit more grace to accommodate those extra courses that the companion may or may not have taken in the past. So IRB is something that you want to know in looking at your project and your site. Is it a possibility? And we talk about that with you once you get to PC 739 and even inbound. Great question. Thank you. So the journey is, it's just that, it's a journey. If Henry Ford would have asked people what they wanted, they would have said faster horses. Nobody was conceptualizing the idea of an automobile at that time, but that's what we're asking you to do. Sometimes people don't know what they want. So you actually have to think about what it is ahead of time that you want for your DNP project and who would be the best people in your site to mention that to, or maybe your site is actually not the best site for you to do this. These are all things that I want you to think about as you're moving forward. And as you plan ahead, these are the questions that I think are really critical for you to think about. Number one, do you have a potential site? Well, it depends. Like, as I said earlier, are you working? Working in a site is by far the easiest way possible for you to get your DNP completed here at Frontier, because those people already know you, number one, which makes buy-in a whole lot easier. But also when you're volunteering, it makes things a little bit stickier just for credentialing's sake, but you can do it. It just becomes a little bit more challenging if you're actively employed in one place and still have to volunteer somewhere else 3 days a week for 6 months. You can see how that whole dynamic would be very, very time consuming. You also want to consider when you will be starting your new job as an advanced practice nurse. Remember, you can implement in either your current role as an RN or your APRN role. You do not have to implement your project as an APRN, but think about how much time it will take you to transition into practice and how much time your actual onboarding will take at your new job, because you still have coursework to complete. You still have stuff to do outside of the actual assignments. You have a lot of the DNP is mental work. And that's what a lot of people don't take into consideration as they're planning their DNP. You also want to think about any major life events that you may have. Are you moving? Are you getting married? Are you getting a divorce? Is there the possibility that you will be caring for someone in your family that you're not sure? All of those things are things to think about. We do have a policy where you can get 2 academic hiatuses in a 365-day period of time, meaning you can take a term off, no questions asked, if you apply for it in advance of the term, in case something pops up, because we all know that's life. Life doesn't go along this linear fashion. It's always like a whole bunch of ups and downs. So we do have that available to you. We know that not everybody is going to move at the same pace. So just as long as you complete your degree by the timeline, you'll be fine. And then you also want to look like, what does your overall schedule look like? If you're someone like me and you're like, you know what, my family's important, but right now I'd rather just zoom through it and I'll catch up with people later, you can certainly do that. Or maybe you're more like a Dr. Kristen Gianellis, who is like, you know what, I actually do want to get my DNP, but it's really important that I'm there for my work responsibilities or my family, or I have this other thing going on. It's really important. And then you do it a little bit slower. So the thing is, we can tailor this to you. So don't feel like, oh my gosh, they said that it's 18 months. What if I need to take, 21 months or the full 2.5 years? by all means take it. And I am always here to help students, along with the academic advisors, troubleshoot what is the best plan or the best option for you at any given moment. So, are you ready to take that leap into the unknown and improve your systems leadership skills? Because the distance between who you are today and who you want to be is only separated by not just your words, but your actions. And a lot of what we will be doing in the DNP program is actionable. Like, we want implementation. We don't just want you to talk about it. We want you to actually do it. We also know that there will be obstacles. There will be people doubting you. Oh gosh, there will be a lot of people that say, why on earth would you want to get your DNP? And I could sit here and probably list 10 reasons that you should, again, off the top of my head. It's not about them. It's about what you want and what you see for your career and your future and what's important to you. We also know that there will be mistakes. There is not a perfect person in this universe. I have yet to find them. I don't think I ever will. We are all imperfectly perfect just the way that we are, right? So know that there will be mistakes, but as long as you work hard, the sky is the limit. If you have any questions about financial aid, please feel free to contact our financial aid office. And if you have any admissions questions, you can contact FNU admissions at frontier.edu. And now I will ask any other questions you may have. Let me stop screen sharing again. And please feel free to unmute. I see that Richard also dropped in the phone number for admissions for those people who like to talk to people live. So feel free, ask me any other questions. I see Dr. Gianellis has done a great job of answering your questions in the chat.
Did you say that the program takes about, is it like 18 to 24 months? Is that?
Yes. So the program, the regular plan of study that we provide to you during DNP Bound is actually an 18-month plan of study. But there are students who are like, you know what? I'm in no rush and I'm going to take the full 24 months. We just adjust your plan of study.
Okay.
And you can start with one plan of study and then decide, oh, me taking those 2 classes all together was just enough and I'd rather do something slower. So we are flexible enough that we can adjust it as you go through it.
Okay. And then those 3 classes that you mentioned taking early, if possible, like the 713, 702, and 718, those are changing when, I mean, like I should have those done preferably by when? I kind of missed out on that portion a little bit.
So if are you a current companion student?
I'm in the CNEP program.
Yes. So you have the option in your plan of study to build those in as you go. So when you meet with your academic advisor, tell them that you're interested in continuing on to pursue your DNP, and then they can add those courses, or you can just wait till the DNP. Just know that it would, once you're in the DNP, it just stretches out your time. So you might be closer to the 18 months instead of the 12 to 15.
Okay, great. Thank you so much.
So if you apply for direct entry and are not successful on your first board exam, so first off, we're going to change that mindset and you will absolutely be successful on your first board exam attempt. But yes, you could still apply for direct entry because some students actually start taking their first DNP course. We give you a 1-term grace. So let's say you schedule your exam and you don't schedule it before the term starts, but you schedule it during the term starts, then you would just have to do a stop out after that. But if you take your exam before and then you don't pass it, then I think there's still you'd have to do a stopgap. But your academic advisor would be the best person to ask because they know that process inside and out. And I see that Dr. Gianella said that, yes, she took the slow road. So if you have any other questions pertaining to the project, or, you know, for those specific things, admissions, contact admissions, financial aid, contact financial aid. If you're a current student and you have questions about transitioning over into the DNP, contact your academic advisor. And if it's questions about the DNP project itself, please feel free to email me, hara.jefferson@frontier.edu. So I thank you so much for giving up an hour of your afternoon to be with us, and we look forward to having you in our DNP program.